A study by the University of Pretoria and the Department of Health has revealed that there's been a notable increase in the prevalence of type 2 diabetes in recent years. The study further reveals that the disease is the leading cause of death among women in the country. For more on this, I am joined by Dr. Piotie, who's from the Diabetes Research Center at the University of Pretoria. Dr. Piotie, a pleasure to have you on the program this afternoon. So recent research highlights that diabetes is the leading cause of death among women in South Africa. Can you explain why diabetes has become such a significant issue, if you will, particularly for women? And what are the main contributing factors here?
Hello, Mfanfa. Thank you for your question. I hope you can hear me.
Loud and clear. You can go ahead.
Okay, good. Thank you. Indeed, to be more exact, the statistics that you quote are from Statistics South Africa. The Statistics South Africa, they monitor the cause of death in South Africa, and they release on a regular basis the findings based on the death notifications. And based on that, we know now that actually since a couple of years, diabetes was the first cause of death among women. Unfortunately, the updates from those released by Statistics South Africa just this year is that diabetes is now the first cause of death among men and women in the country, surpassing conditions such as HIV and tuberculosis and others. So the issue with diabetes is that we have some risk factors, and that leads to or may lead to the condition being diagnosed. For example, we have obesity and overweight. We know that South African women, unfortunately, are ranked among the the most overweight and obese women in the world. That is really playing a big role. And but I want to take the conversation further to say that it's not just about the individual aspect. Sometimes we tend to blame the person about being overweight. Right. It's actually some factors that are societal and even affecting the community that leads to people being overweight. For example, the access to healthy nutrition. If somebody is unable to afford, you cannot blame the person individually. And the inability to exercise and to have access to secure and safe environment in which to exercise. All those aspects are playing a role, and unfortunately, those circumstances find themselves being met in South Africa and leading to diabetes being such a high cause of death.
Also interesting, Dr. Piotie, is that the study also found that many people with type 2 diabetes, for instance, are not receiving optimal care. What were the key findings from the audit of diabetes care in the Tshwane district? And how do these findings compare to also previous research on this issue?
Yes, unfortunately, again, to demonstrate the fact that we do have a problem in South Africa with diabetes, the parameters that we monitor when we assess good control or good care are not being met. I will give an example of the fact that once a person has been diagnosed with diabetes, they need to receive proper medication in order to manage and control their care. But it's not just limited to medication. They need also proper education in terms of when to take those medications, how does it impact the other aspect of their life. For example, if they are on insulin and they're exercising and so on and so forth. And then you need to monitor on a regular basis the condition. Unfortunately, we are not doing those aspects quite well in the country. Sometimes from what we found in our study is that the doctors and the nurses are sometimes reluctant to intensify the medications. And also we don't give all the resources, the adequate resources to the healthcare workers to monitor the patient adequately. Unfortunately, that leads to high rates of complications such as amputations, such as kidney failures, blindness, and preventable death, as we can see from the statistics at StatsSA.
So also interesting is that the term clinical inertia is being mentioned in your findings. Can you elaborate on what clinical inertia is and how it affects diabetes management, and also speaking to the steps that need to be taken to address this problem?
Yes, thank you very much. Indeed, what we found is some evidence of clinical inertia, and that's not only by our studies. Clinical inertia is a phenomenon that has been described elsewhere in South Africa. In some studies in Cape Town, found some evidence of it, but it's actually a global phenomenon when it comes to diabetes. Just to simplify for the audience, once somebody starts on a treatment for diabetes, we usually start with initial doses, if I can put it like that, whether you are on tablets or on insulin. But those doses are not the optimal dose, meaning the right dose for that patient. So it's an exercise that the healthcare worker will take by adjusting progressively. And it depends on various other factors that can lead to those medications being increased or being decreased. And it is actually in response to the blood test that the doctor or the nurse needs to do. Unfortunately, not only in South Africa, but elsewhere, there is a reluctance on being more aggressive on that intensification. It could be because of lack of knowledge. It could be because of, as I said, the circumstances. For example, in the healthcare sector, where we sometimes have patients who don't have a medical record because the file has been lost. And therefore, the next doctor will be a bit more cautious in terms of managing those patients rather than relying on previous findings. So for us to really address this issue, it comes to about training and equipping the healthcare worker. It's also about empowering and equipping the patient, the people with diabetes, as was the recommendation made by the 2022 Diabetes Summit, whereby we need to have a diabetes education program for our people with diabetes, and we need to have a skilled health workforce that is able to respond to diabetes.
Dr. Piotie, then I guess it also then begs the question on what are the most common reasons, if you will, for the suboptimal management of diabetes in the country, but also as identified in your study? And how do these issues impact both individual patients, but also the healthcare system overall?
Indeed, thank you. That's quite an important question. The issue or the challenge with not managing diabetes well is that the person living with that condition is exposed to high levels of glucose or sugar in the blood, and that will affect what we call target organs. You have your kidneys, your eyes, you have your nerves, you have your extremities. So that person might be amputated, they might have kidney failures, heart conditions, and so on and so forth. And to manage those complications, we find ourselves spending more money than we need to spend initially to treat the person. As you say, prevention is better than cure. So having a high rates of complications, having poor diabetes management in the country leads to the health system and the families and the individuals spending more rather than what was supposed to be spent in the beginning. So it's a really a wake-up call that was made by the 2020 Diabetes Summit, is that we need to address those high rates of complications. We need to address the challenge of poor management. Diabetes is a chronic condition. The patient or the person with diabetes might see the doctor maybe 5 minutes every 3 months. That's not enough. That means as a person, you spend more time with your condition than you will obviously spend seeing your doctor. Therefore, the person with diabetes needs to be empowered, educated, given the skills, the necessary skills to manage their condition themselves. The doctor or the nurse only comes to reinforce those skills and to guide when it comes to increasing medications, when it comes to preventing the complications and stuff like that. So we need to really relook at the way we are managing diabetes in South Africa. The unfortunate part is that our health system has been for the longest time strengthened to respond to HIV and other communicable diseases. It's time we have the shift to make it really a health system that can respond to non-communicable diseases such as diabetes, cancer, hypertension, and so on and so forth.
So in terms of healthcare infrastructure, what are some of the major challenges that indeed hinder effective diabetes management in the country? And how do these challenges differ between public and private healthcare sectors?
When it comes to infrastructure, health system infrastructure, I think the first thing that I would say is that we don't have what is called a diabetes surveillance system. Other countries have what they call national diabetes registry, whereby we can keep a look on how many people are having diabetes, how many people already have diabetes. But beyond that, we can keep an eye on how well are they doing when it comes to the management and the control. We can keep an eye on whether they are developing complications or not, whether they are responding to treatment and stuff like that. So that once, based on the numbers that we're receiving from monitoring or having that kind of close monitoring, we can adapt and make new interventions. Unfortunately, as it is in South Africa, there is no diabetes surveillance system. What we have as numbers, for example, when we say that 4.2 or 3 million South Africans are living with diabetes, these are estimates from the International Diabetes Federation, and they are not necessarily the exact reflection of what is happening. We believe that as the Diabetes Alliance, as the researchers and experts who came together at the Diabetes Summit last year, we need to have a strong diabetes surveillance system that will allow us, allow the minister, allow everybody to really keep an eye on this major threat that is diabetes. Beyond that, we realize that there are some deficits in the health system. For example, we are still relying on a paper-based system whereby the patient files are written down. Sometimes you cannot read what is written because the doctor was doing it in a hurry and stuff like that. And losing that memory in the patient file sometimes affects the treatment that the patient is receiving. Quickly, I can mention the fact that in the space of diabetes, there's been so many new developments, new exciting development in terms of research of new drugs and more effective drugs. Unfortunately, the department, the public health sector is slow in integrating all those new drugs. So those are some of those gaps that we think can be quickly addressed in the public sector in terms of responding to diabetes.
Right. Dr. Piotie, thank you so much for your time and sharing your insights into the diabetes crisis in South Africa. Of course, also for informing findings by a study run by Dr. Piotie and others.